Hello, so we're going to be giving cefazolin today. It's an antibiotic. We're going to be doing it through an intermittent IV device. So first things first, let's go ahead, wash our hands, and check out our mark. So we're going to go with today's date. Perfect. Name for this patient. Let's take a look at the drug. Cefazolin, 1 gram IV, Q8 hours times 48 hours. And it hasn't been given, so we're going to be giving it today. So first things I want to do is take the medication out of the drawer. And I'm going to go ahead and do my first check. So this is cefazolin, 1 gram, expiry 12/20/30. So I know that it's good to go. Now that I've got cefazolin out, I should probably take a look at my IV monograph, seeing as I'm going to be doing that through, and it's one of our policies that we have to check it. So I've gone to the VHOS site, I pulled up the IV monograph for cefazolin. I see the indications for use is for infections, contraindications is a hypersensitivity, so I'm going to make sure that I check that out. Cautions through here, I'm going to be taking a look at my interactions, my drug to drug, and this is important to look at the intermittent infusion. So who may give? I can give it as a RN, adult dosage, so we're going to dilute in 50 to 100 milliliter mini bag, infuse over 15 to 30 minutes. So we're going to be doing 100 mils over 20 minutes. There is no monitoring required, none recommending. It's talking about reconstituting here with normal saline, which is what we're going to be doing. Some fluid compatibilities and keeping it in fridge and whatnot, so I'll be paying attention to that. And then just looking at our adverse effects so that we know what education to provide to the patient, and then also we know what to look for. Perfect. Okay, so now that I've done that, I can go ahead and get some equipment ready that I'm going to need to reconstitute. So we've got our saline bag here and our reconstitution device. So this is 0.9% sodium chloride. This is also not expired, so that's good that we're going to be using that. And then this is not expired here, the reconstitution device. Perfect. So we're ready to pour the medication. Why don't we go ahead and complete our 7 rates? So first things first, we're going to go off with the right patient. So right patient, this is Jen Eric. Perfect. Right drug, we've got cefazolin, 1 gram, expiry 12/20/30. So we've done our second check, and we're also carrying on with our 7 rates. Our dosage, this is nice and easy. We've got a 1 gram ordered, and it's 1 gram supplied. So I can do the math, and it would be 1, or we can just use common sense. 1 gram ordered, 1 gram delivered. I'm going to be reconstituting the whole medication today. Route, we're going to be giving it IV. Time, we're going to be giving it at 8 o'clock today. Reason, we've discussed that it's an antibiotic for infections. Sometimes it's used prophylactically. Then we're going to provide our documentation. So I'm going to go ahead and get this ready to go. So first things first, I'm going to need some alcohol swabs. I'm going to give my hands another sanitize here. And I'm going to go ahead and sanitize this. Perfect. Now I'm going to be, so that's 15 to 30 seconds, and I'm going to let that dry for 15 to 30 seconds. I've got it on this alcohol swab, so we know that it's good. We've got another alcohol swab here, and I'm going to get this ready. So we're going to pop that top. And we're going to give this clean 15 to 30 seconds. Let that dry for 15 to 30 seconds. Next, we've got a reconstitution device. So hold this and look for the loose end. It should be right here. Chew up all my time just doing this. Okay, so we've got that. We're not going to touch that. That's a sharp. This is dry for 15 to 30 seconds. We're going to go ahead and place that on there. Perfect. Now we've got this. This is still sterile, and then we're going to add it to our medication, or fluid here. And we're going to go ahead and displace some of this fluid into the medication vial here. Perfect. Now we can, we're reconstituting it. So we've got to make sure that it's, all the medication is mixed here. So I'm not shaking it, I'm just giving it a gentle stir. Okay, looks to be all constituted here, so I'm going to flip it over and we're going to get that medication out of the vial and into the bag. Perfect. So we've got that just like that. I'm going to leave that right there for now. The sharp's contained. I don't have any worries there. It's just me here. It's perfectly safe. I'm going to set my bag and I'm going to create my medication label. So let's fill this out. So we've got generic here. Room 3 drug. We're going to be using cefazolin today. 1 gram. Added by myself, BK, NIC, BSN 2. Today's date, Feb 23rd, 23. Time, 8 o'clock. Start time, we're going to be probably 8:05 on that one. And date, same as today. Okay, now we got our flow rate here. So let's go ahead and calculate that. So I see on my order that we're going to be giving 100 milliliters over 20 minutes. So let's go ahead and do some math on that. I'm just going to use a blank piece of paper here. So 100 mils over 20 minutes is equal to 300 mils over an hour. So that's what we're going to use to calculate our drip rate. So we've got 300 milliliters times by our drop factor, which is going to be on our secondary IV line. That's 10. Divide by 60. That gives me 50 drops per minute. So that's going to be our flow rate. So we can go ahead and put this on here as 50 drops per minute. And that will infuse 100 milliliters over 20 minutes. So we've got this. Go ahead and place that. So now that I've made sure that we got cefazolin, I can do my last check, which is returning the medication or discarding the packaging. So cefazolin, 1 gram, 1 gram, not expired. Okay, so I can go ahead and dispose of that. So we're going to have to ensure patency. So what I'm going to do is I'm just going to get this out of the bag here. This is sodium chloride. It's not expired. And because I'm giving it, I'm going to have to create a label. So we're just going to put as same information. So generic. This is just normal saline. Room 3, amount, we'll leave that blank. Today's date, February, start time, 8 o'clock. Perfect. So I'm going to go ahead and put that on here just because we are giving it into a person intravenously, so we need to make sure that that it's not confused with something else. Put that on there. Okay, so we've got our medication, we've got our flush, we've got our MAR. I'm going to go ahead and get this lovely secondary tubing out of its container. We got that ready to go. Let's bring a couple alcohol swabs. We're going to need those. And I'm going to grab a couple gloves. Look at all these gloves. Hey, just take one. Okay, great. So we're going to bring all of our stuff to the bedside. We're going to introduce ourselves. Hello, my name's Ben. I'm a nursing student. I'm going to be giving you some cefazolin today. What's your name?
Jen Eric.
Hi, Jen Eric. So I'm just going to be checking your wristband here, and I'm just going to do 2 positive patient identifiers, okay? I don't want to bend too far over, so I'm going to bring your name, your bed up. So I see here the name matches, date of birth matches, PHN even matches. Great. Do you have any allergies?
No.
Perfect. And yeah, I don't see any allergies on your allergy band here. Great. So I'm going to be giving you this antibiotic today. It's going to be for your infection, prophylactically or not. So I'm going to hang this bag. Let's get that in a proper space here. And grab my flush, my gloves. So I've got to make sure that the IV is patent. Do some hand hygiene. Don some gloves. Have you had any problems with your IV today?
No, it's great.
No? Okay. Lovely. So I'm going to clamp this line if it's not already done. And we're just going to take a look at our IV site. We're going to be looking for any redness, any swelling, any heat. I don't feel any. And we can also compare it with the other side just to make sure that, it's, if there was an abnormality, that we would see it cross. But there's no abnormality there. I don't see any I don't see any bulges. I don't see any, it doesn't look gross or blood filled or anything like that. So it's looking really good. I don't see any problems there. So why don't we go ahead and check for patency here. So what I'm going to do, I'm going to have my saline here, and I'm going to be using this port here to check for patency. So we can take that off, 15 to 30 seconds, cleaning that. And we'll also let that dry for 15 to 30 seconds. We'll take this off, it's dry for 15 to 30 seconds, get rid of that air, and we'll go ahead and put it in here. So what I'm going to be looking for here, so I'm going to take this clamp off here, and I'm just going to aspirate, and I do see blood back in my, back in the line. So then we're going to just give a little bit of fluid, 1 mil push, perfect, 1 mil push. And then on our last one, we want to leave this line with positive pressure. So we're going to do about 4 mils and clamp before we stop. Perfect. So we've ensured patency here. That line flush is great. I'm going to get rid of this just so we don't put any hazards here. We're going to put it in the garbage. And we're ready to hang your line. So what I'm going to do is I'm going to piggyback fill this tubing. We know that this comes out of a sterile container. We know to take this off, it's going to stay sterile as well. We're going to pop that in here and make sure this line is clamped. Next, we can grab another swab, making sure not to touch that. Wipe this for 15 to 30 seconds. Let it dry for 15 to 30 seconds. We can attach this here. So everything's closed right now. What I want to do is I just want to backfill this line. So what I'm going to do is I'm going to bring the medication bag down. I'm going to ensure that the line to the patient is closed. I'm going to open this medication line. So bring that lower. We're going to see that we're going to see this fluid come out of the primary, and it's going to backfill this here. We're getting all our bubbles out. This is an old line, so there wouldn't be this many bubbles off the bat. Perfect, and we're going to fill the chamber to about half to 2/3 full so that we can visualize the drops. So we've got this closed, this closed. We're going to go ahead and put this into our intermittent IV device, the pump, and we're going to set it at 50 drops per minute. That's the rate that we calculated for 100 mils over 20 minutes. We can also go through and select cefazolin on here and select the right infusion rate. So next, we're going to go ahead and open everything up. So we're going to open this up, and we're going to open the line up here, and finally our clamp here. We want to see the fluid running through our line. We're not hearing any alarms. Make sure the pump's all set up properly, the pump's plugged in. We're going to ask the patient if they've got any questions, if we can provide any teaching around some of the adverse effects that the medication could have, if it was their first time, and make sure the patient's call bell is in reach. In case they do have one of those adverse reactions, they can give us a call. We're going to return the bed back to a safe height for the patient, and I've got to do some documentation on this. So let's do our documentation. We've given the drug BKNICBSN2 at 8 o'clock. Perfect. That's everything.